So I'm making this video today. I have some of my patients who follow me on TikTok, and they have expressed the desire for me to talk about mental health because that's what they know me for, mental health provider. They said, oh, I just talk about God. So I want to drop this video, and subsequently, if I have time, I'm very busy, but if I have time, I can talk about other mental health issues. If you bring specific questions that will make it easier or guide me or how to go about it, right? Now I want to talk about medications, and specifically class of medication called SSRIs. Those are selective serotonin reuptake inhibitors. Those are used to treat depression, anxiety, and other mental health issues like OCD, panic attacks, and it's also used to treat some symptoms of PTSD, right? Now, I just read an article that said that this young man committed suicide. He killed himself because it was a side effect of a medication he was taking, sertraline, and it's been attributed to that side effect. And the main point about that article is education and teaching about the side effects of medication. Now, there's a black box warning, and providers need to retaliate and need to stress on that black box warning when they are prescribing medications to you. That SSRIs, SNRIs, selective serotonin reuptake inhibitors, and serotonin norepinephrine reuptake inhibitors, and antidepressants, the black box warning, there's a high risk for suicidal ideation and suicidal thoughts or behaviors, especially for children and adolescents. But that does not mean that adults are exempt. No, the risk is lower, but it still also affect them. It could affect them, so they are not exempt. Anyone who is taking an SSRI or SNRIs, when I talk about SSRIs, drugs like sertraline, citalopram, Celexa, and fluoxetine, paroxetine, fluvoxamine, those SSRIs, and SNRIs like Effexor and those other class of medication, and Wellbutrin and stuff like that, right? So if you're being prescribed one of those medications, my rule of thumb, if you see any sudden change in behavior, undesirable side effects, you don't like how the medication makes you feel, stop the medication right away. Family members, when your loved ones are being prescribed any sort of medication, for the first few days or weeks, you need to keep your eye on them, monitor them for any sudden changes. And the first thing is to discontinue the agent, the medication that is causing it. Seek professional help. Call your provider. Go to urgent care. Call 911. Don't take anything for granted. All right? It's clear. Black box warning for SSRI, SNRI. Suicidal thoughts, suicide behavior, high in children and adolescents, and adults also need to be monitored once they are prescribed those medication. I hope this makes sense, and I'll be back when I get inspired by something else, by another topic, or if you have specific questions, drop them for me and we can talk about it. Okay, shout out.